Diabetes. It's the 5th deadliest disease in the United States, yet 1 in 3 people doesn't know he or she has the disease. The silent killer, diabetes. That's the topic on this edition of Healthy Living. Stay with us. According to the American Diabetes Association, nearly 21 million people in the United States have diabetes. Over 14 million have been diagnosed, while more than 6 million are unaware they have the disease. Each day, over 4,000 people hear the words, "You have diabetes." What is this disease, and what can we do about it? Here to discuss that with me are Debbie Bray and Trish Mavigliano, both registered dietitians at Lourdes Hospital. Thank you for joining me. We're just going to start out talking about what is diabetes, and there are different types, and we'll just start out with the overall scope of what diabetes is. Debbie?
Okay, sure. Diabetes is a state in which you are not utilizing sugar properly in your body. Your body either doesn't have enough insulin to process that sugar, or the insulin that's there is not available or not working correctly. So that's kind of just a simple explanation.
And that works into the definitions of 1 and 2. But before we get there, there's something called pre-diabetes. Give me a little bit, Tish.
It's pretty much where the blood sugar levels are not really high enough to be diagnostic of having diabetes, but they're a little elevated. I guess I kind of like to make the joke at times saying the term borderline. We don't like to use that term anymore. So now they've come up with the term prediabetes. Another term it's also called is glucose intolerance. And again, it's just where the levels are just high enough, above normal, excuse me, but they're not high enough to be diagnosed with diabetes.
What's normal?
Less than 100.
Less than 100 your fasting blood sugar is normal.
So fasting is for how long? If you go and get your blood sugar tested, how long would be fasting?
Probably good 8 hours. Yeah.
Good 8 hours.
Yeah.
So under 100. So I went to the doctor, and fasting for 12 hours, my blood sugar was 105.
Okay.
To which my doctor said, you need to lose a few pounds and bring down that sugar level. And we'll talk about how important weight loss is in another segment. But I was elevated. So I was pre-diabetic.
Correct. And so that your doctor was doing you a big favor in telling you that early on, because people with prediabetes can actually make lifestyle changes to prevent going into full-blown diabetes. So you've got a chance. Once you're diagnosed with diabetes, there's no going back. But you've had that chance to make a change by losing some weight, getting some exercise. You were able to improve your blood sugar levels and kind of reverse that state, which is a really great thing.
Well, you talk about reversing that. My mother was diagnosed with diabetes, but she was obese. And when she lost all of her weight, her blood sugar dropped within normal range. So, is she still diabetic even though her range dropped below 100 after she lost all of her weight? Is she still considered
We would
a diabetic?
say yes, she's still a diabetic, but a well-controlled one.
Okay.
Okay. Once you have that diagnosis, it stays with you. So.
All right. So we've talked about prediabetes. Now 1 and 2, there's a big difference between those two. So what is type 1 diabetes?
You mean to talk about that?
Sure.
Okay. Type 1 diabetes is where pretty much the pancreas shuts down. It's not making any insulin at all. And with type 2 diabetes, there's still some insulin on board, but just not enough to get the blood sugar levels where they should be. Usually, the symptoms with type 1, it's pretty quick in onset. To differ that from type 2, that type 2 symptoms tend to kind of be a little bit more discreet.
More vague, yeah.
And we'll talk about those symptoms. But you said insulin. And your body, your pancreas doesn't, if you are type 1, it doesn't create insulin. It just shuts down. What is insulin, and why is it important to your body?
Well, it's a hormone, and the function of it is to get the food out of our blood, to get it into our cells. That's what gives you the energy. You know, if you ever feel like you're kind of lull because you haven't had lunch.
Always
something
before
of that,
10 a.m. That's how I feel.
Something of that sort. you need to eat. So after you eat, you feel like you have a little bit more energy. Your body knows to spit out the insulin to get that food out of the blood and into the cells. So the function of it is to do that, to get the food out of the blood.
It's kind of a transporting system. Insulin transports. We kind of think of it that way. Sugar from the blood into the cells.
So if it doesn't get into the cells, where does it go? What happens to it?
Well, it hangs around in your bloodstream, and you go get your blood tested, and you see that elevation, which can be diabetes. So
if you don't have it moving through your cells, that's how important it is to keep that insulin at. The insulin is what produces for the blood sugar to tell you whether or not it's moving into your cells, right? I mean, the insulin is what moves into your cells.
the insulin is what moves sugar into your cells.
Okay, so the
Does that make
pancreas
sense?
makes the insulin. And then that is, like you said, like the vehicle.
Correct.
That
to
gets it to go
transport
into your
sugar
cell.
to the cells, right.
So if I don't have that, I'm feeling lethargic.
Exactly.
So I don't eat breakfast, so I don't have the energy moving into my cells.
Right.
Okay.
Right.
Note to self, eat breakfast. That's good. All right, something happened to me when I got pregnant with my second child called gestational diabetes. Never heard of it, didn't have any idea what it was. And you go in, and when you're pregnant, you have to drink this very sugary orange drink. And, you know, I did it the first time, and I must not have had gestational diabetes because nothing ever came of it. And then the second time, they said I had that, and I had to cut out all my sugar and all my candy and chocolate, which was very upsetting to me. And what happened to my body? What makes that happen? What makes you have gestational diabetes when you're pregnant?
When you're pregnant, your body's under, more demand. You've got, the baby's needs, and you're gaining some weight, and sometimes just that extra demand, your body doesn't use the insulin. Your body becomes resistant to using insulin like it did before, and so your blood sugars start elevating, and we see that gestational diabetes, which is usually just a temporary state. Usually once you deliver the baby, in most cases, blood sugar returns to normal, but those women need to be screened every year for type 2 diabetes because they're at more risk, a 50% more risk of developing diabetes in the future.
Later, the type 2 diabetes.
Right, type 2.
And if you kind of look at type 2, a lot of your type 2s that might be overweight or obese, that's a huge risk factor. And looking at that with gestational diabetes, maybe a girl that is pregnant and has the gestational diabetes, she might be a little overweight while she's pregnant. So kind of like what Debbie was talking about, where the body is just really trying to take care of the body as well as the fetus or the baby. That can happen. So trying to be at a good weight, not a twiggy weight, but trying to be at a good healthy weight is really important whenever you are trying to get pregnant to prevent something like that from happening.
Well, I was roughly the same weight the first time I got pregnant as the second time. And I only gained like 17 pounds the first time and 20 pounds the second time. So what was the difference? Because the first time I didn't have it and the second time I did. And so is there something with the second pregnancy sometimes that it's...
I know that hormones can play a role in that as well too, not just necessarily the weight, but hormones can play a factor as far as developing gestational diabetes. So if you were at a healthy weight, it could have been that issue there going on. Because what those hormones tend to do is they'll go down to the liver, and excuse me for the way I'm going to explain this, but shake the liver up, and the liver will spit out some glucose. So I can't say, we're not sitting here trying to diagnose why this happened or not, but those could be a couple of factors.
It's kind of an unknown, really kind of an unknown thing. And the older you are, the second pregnancy,
So that because
that
the
can
older
make a
you
little
are, that's
difference,
another
the
risk
more
factor.
likely you are.
The older you are, the more susceptible you can be to diabetes. I was
Correct.
quite a bit older the second time. Two words that do they go with diabetes that I hear these words all the time: hypoglycemia and hyperglycemia. Do those correlate with diabetes at all? What do those two words mean? I hear people say, I have to eat because, or I have had too much sugar. What are the differences in those two things? And do they...
Right, well, people can have a condition called hypoglycemia, which is low blood sugar. That's not diabetes.
Okay.
It's just that their blood sugar is, for some reason, drops very low, and they need to eat more often and more frequently to kind of prevent that from happening. Sometimes people with hypoglycemia, though, there's a correlation between them developing diabetes later in life, just showing kind of early on that mechanism for regulating blood sugar, something's not right early on that they're having that hypoglycemia. So sometimes you'll see it manifest itself as diabetes, years down the road.
Well,
So-
and one thing that I hear people who say, oh, I need to eat something, the first thing they want to do is have a candy bar, or they want to eat some type of sugary food. Well, the more you do that, the more sugar that you eat, will that also lend itself years later?
That's
that
kind
you
of a
will-
hypothesis. What they're believing about hypoglycemia is that whenever they eat something that tends to have a lot of carbohydrate in it, sometimes they'll use the term simple sugar. They're trying to get away from that. But anyway,
There's
something
no
that has
such thing as simple sugar.
something that has a lot of carbohydrate in it, they believe that the pancreas tends to produce more insulin to help bring it down. So if you've ever talked to someone that has hypoglycemia, they'll typically say, for those that have probably had some education, will typically say peanut butter and crackers, cheese and crackers.
Right.
So
Something
they-
that isn't just way off the
Yeah.
scale of sugar and carbohydrates. So hypoglycemia then is high blood sugar.
Hyper.
Oh, excuse me.
Hyper.
See, I got it mixed up. That's why we're here. Hyperglycemia is then you are diabetic if you have hyperglycememia.
Well, depending on what your level is, right?
Okay, if
There's
it's over-
certain diagnosis criteria. Yeah, if your fasting blood sugar is 126 or above, that's considered hyperglycemia or diabetes. So,
Okay, so pre-diabetes was the 100.
Right,
And
100
then-
to 125.
So if you're from 100 to 125, you're in that borderline that you don't like to say anymore, pre-diabetes.
pre-diabetes, right.
And 126 and over, if your blood sugar is that, then you are diabetic.
Correct.
Okay, and you just don't know which kind you have until you go and get tested, if your body is producing
Right.
it or just doesn't know how to use it.
True.
You said I don't know if you said this, but before the show you said a very startling statistic about the gestational diabetes. Because I have had that, then you said I have a 50% more chance of getting diabetes than
Type
someone who
2,
has it, type
right.
2.
Later
who
in
has-
life,
Later
right.
in life.
Right.
So,
So be screened every year, maintain a good weight, a normal weight, and exercise. Those are the main things to remember. So.
That's easier said than done.
it is. It is. It is because, particularly for someone who really enjoyed eating, before I lost this weight, really enjoyed eating candy and sugar and white flour and all the carbohydrates. I mean, if on a desert island, I'm taking rolls and candy. That's what I'm taking. And when you have to lose weight and do those kinds of things, that's not what you can have. And it was such a shock to my system. The first 3 weeks to a month of trying to bring myself down off sugar was so hard. I was the type of person who said, "Oh, I'm having my lunch. What's for dessert?" That was my first question. That's what I want. So it's a whole training yourself. It's a different lifestyle. And like you said, I got a warning because both of my parents, my mother had it, my father had it. I had gestational diabetes, and I was overweight. So I had several of the risk factors to really get the warning sign to do something about it. Are there people who are more susceptible, races and ages of people who are more susceptible to diabetes? Race, ethnic groups.
Right. Ethnic groups, the literature says that African Americans, Hispanics, Pacific Islanders, those three, Indians, am I leaving
Indians,
any? Those particular ethnic groups are at a higher risk or just have a higher incidence, more diabetes.
Why is
those.
that? Do they-
And I don't know that there's a specific reason behind that. Have you ever read
I
anything
haven't.
specifically? But those, it's just documented that those ethnic groups have higher rates. And it could be, education, could be maybe some of the cultural eating habits. I mean, those things all play into it.
And
so.
I believe they are doing studies on that to really pinpoint that, because it does seem kind of strange. Why is it just these groups of people that it tends to be a lot higher in than others?
What are the statistics as far as how much higher? Do you know any of those statistics?
I don't
don't.
Not
offhand.
right offhand.
I don't
Just more
offhand.
susceptible. So would they need to be tested more often, or once a year enough?
I
do
think
you
the once a year routine screening. I think
Especially
is
if you get
fine,
the
yeah.
pre-diabetes, then you get the warning sign again.
Absolutely.
We're getting ready to take a break. Then we're going to come back and we're going to talk about those symptoms and those risk factors a little bit more in detail. Ask yourself these questions. I am a woman who had a baby weighing more than 9 pounds at birth. I have a sister or a brother with diabetes. I have a parent with diabetes. I am under 65 years of age and get little or no exercise. Those are some of the questions that pertain to risk factors Ask yourself these questions and come back with us if you've answered yes to any of these questions, because you may need some of the information that's coming up in the next segment. Stay with us.
Someday, I'll be a ballerina, just like them. And this will be my stage, where I twirl and float and swirl for all the people looking at me. Someday, this won't just be my wish. Someday, I won't be sick.
Welcome back. The topic of this edition of Healthy Living is diabetes. I want to reintroduce my guest. I have Trish Mavigliano, a registered dietitian at Lourdes Hospital, and Debbie Bray, a registered nurse at Lourdes Hospital, to kind of help us figure out this silent killer, is what they're calling diabetes. And there's reasons for that. But before, I want to know how many of you out there, the questions that before we went to break. I'm a woman who has had a baby weighing more than 9 pounds at birth. I have a sister or brother with diabetes. I have a parent with diabetes. I am under 65 years of age and get little or no exercise. Why these questions? Why are they important? Why are the answers to these questions important?
Right, because if you can answer yes to any of those questions, you might be at risk for developing diabetes. And so you want to, let your doctor know that you answered yes to one of those questions and have a blood sugar test and have that checked out for sure.
So I have the risk factors. Family history. Is that a big one? Mm-hmm. I mean, because sometimes it doesn't matter what you do. If your parents are diabetic, and you have a much greater chance of being diabetic. Is that true? Mm-hmm. And then if you are, some things you do or don't do to try and regulate that, I mean, you just may be predisposed, and that's just the way it is. Right. Obesity, lack of physical activity, smoking, stress, and poor eating habits. Those are the top 6 that I found. So why is being overweight, what does obesity have to do with that?
I guess one of the things that I do in the class that I teach, I try to explain to people how the insulin clears the food out of the blood and it goes into the cell. And your cells should be a certain size, but kind of like myself, as I get older, you kind of kick back and you're not as active and maybe eat a little bit more than what I used to. Well, that means I'm probably putting some weight on. The cells tend to expand. Well, we know that because britches fit a little bit tighter, our clothes are fitting a little tighter. And if you kind of think of, hey, the insulin is supposed to fit in that cell kind of like a key in a door. And if my cell is a little bit bigger than what it should be, it's not going to fit in there like it should. So looking at being overweight or obese as a risk factor, that's kind of how I try to put it in perspective for people to understand. We're not just saying lose weight just to sound like a broken record or something easy to say. It has meaning to it. You get those cells back to a good size, that insulin is going to work like it's supposed to. Just kind of like with yourself. What'd you say you did? You lost how many pounds?
35.
35 pounds, and that blood sugar.
It went from 105 to 87 fasting, which I was so excited about. My cholesterol dropped, and all of that was great. I just had never pictured it like that. That my cells, when I was heavier, were bigger. I mean, you don't think about your cells expanding. I don't know why. You just think about my pants don't fit, and the rest of me is expanding for
Right.
everyone on the outside to see.
Right.
I've never thought of it as that my inside cells are expanding, and my insulin, I was more resistant to that, and it was harder for my body to burn that sugar. And that's a very interesting analogy. I've never heard that before. Of course, the lack of physical activity, because you burn more sugar when you exercise.
When you're active, your body uses sugar more effectively. Insulin works better in the body when you exercise regularly. So, and exercise helps you keep a normal weight. So, when you don't exercise, you're more sedentary. You tend to put on the pounds. So that's kind of what we see.
Tell me about it.
Yeah.
Tell me about it. Okay. One of the things that we talked about in the first segment were the symptoms. Now, in type 1, which is that your pancreas doesn't make the insulin. It shuts down. You said that the onset of the symptoms were very acute. They're very quick. What are some of the symptoms of type 1?
With type 1, the usual symptoms are weight loss. That's probably one of the bigger ones, wouldn't you say? And I can say that for myself as well. Weight loss, extreme thirst, dry mouth, fatigued. When I say fatigued, just tired. You're sitting down and you're ready to knock off to go to sleep. And again, going back to my lovely scientific explanation of it, the food is not getting in my cells, so I am going to feel tired. But those are probably more the common ones. Can you think of some more common ones?
Well, we have some on the screen. Are these
Frequent
more?
urination, of course, is going to be a big one.
That's a big one.
Cuts or sores that don't heal.
Irritability, what is that? Is it just because you're so tired and mood changes?
Sure.
I mean, just because you're so tired. For type 2, which again, to reiterate, is that your body it produces insulin, but it just doesn't know what to do with it.
It doesn't use it correctly.
It doesn't use it correctly. It can't get it into the cells the way it needs to.
Right.
The symptoms are the same.
The symptoms are the same.
But I think it's just more so how quickly that it happens. With type 1s, it tends to happen a lot quicker than with type 2s. And it probably makes sense in that type 2s still have a little bit of insulin on board. So maybe it's not going to, be so severe so quick.
Because you have been diagnosed with type 1 diabetes from a very young age. And so where you lost a lot of weight immediately, and just how did that happen?
The story that I tell in the classes is, how old was I? 11 years old. And the mall had just opened down the road, Kentucky Oaks Mall. My mom took me there. We bought a skirt and a sweater. It was on a Sunday. I was going to wear it the following Sunday to church. When I went to put the skirt on, it fell off of me.
Oh my goodness.
Well, I wasn't thinking anything. I just thought, Mom bought this dumb skirt too big for me so I could grow into it. That was my thought. Well,
Moms don't do that kind of thing.
No. Well, of course, that Sunday, my mom realized that, and looking back now, she said, I knew something was wrong. She said, you were thin and you weren't acting like you usually do. And of course, that next day is whenever we went to a clinic out. We live out in the country, and we went out there and had the classical symptoms like we were talking about, the weight loss, the dry mouth, frequent thirst, and frequent urination.
And so you just knew something was wrong then?
My mom did. Now, I really didn't. I just felt like I was sick and so forth, but...
Because you were just 11.
Yes, 11 years
But,
old.
I mean, had you been older, you might have thought, oh, I just bought this skirt.
Yeah.
And I know it fit last week,
Right.
and it doesn't fit now. Can you gain a lot of weight? Can it go the other way?
It can, not necessarily with type 1, but we're seeing some with type 2 children. Was that your question?
Well, because one of the things that we talked about, or wanted to talk about, was that more and more children are getting, or are pre-diabetic particularly,
Yes.
like 41 million children are pre-diabetic. And it said in my research, like 2 million have diabetes. That's a lot of children, and a lot of that is probably attributed to, what would you think?
Well, sedentary lifestyle and being
Video
more overweight.
games.
Yeah, our kids are more overweight than they've ever been, and and you're right, they're playing video games, they're not getting exercise and out playing like they used to be.
Fast food?
Fast food, sure, all those things contribute to being overweight, so they're more likely to develop what used to be thought of as just adult type diabetes, type 2. And now we're seeing type 2 develop in children because of these lifestyle issues that are going on.
And it's very hard because they do love to play the video games, and they do like to watch, television. When I was a kid, I will never forget that it was the first time that they had television 24 hours a day, like on TBS. And I remember saying to my dad, "This is never going to catch on. Who's going to be up all night watching TV?" Little did I know, at however young I was, that it was going to be the fad, and it was going to be everybody was going to be on all night long. And so now, you have all-day cartoons. You have the Cartoon Network, and used to we watched them on Saturday morning, and that was it. That was the only time that you got to watch cartoons.
Right.
And Nickelodeon. So they have all of these channels that are designated just for them,
Right.
and they want to watch TV. And sad to say, this is with my daughter. When I was a kid, I left the house and I was gone all day long. And I came home to eat, and that was it. And my mom never, worried about me. But nowadays, I'm scared to let my daughter go down the street and stay for long periods of time without me knowing exactly where she is. Because today's society is different, People are taking kids now, and so I have that paranoia in my life, that I want to keep her right in the front yard, and she can't go ride her bike for all hours of the day and be gone.
Right.
So there's all these different factors that are doing that. So you get her into all these programs, swimming and all these things to try and give her something that I have more control over.
Right. And that's where parents have to kind of jump in, I think, and set some limits. Get them off the computer, get them off the TV, get them outside. Kind of set limits for kids, because like you said, they'll go nonstop. So.
Right. Preach it, sister, because you're talking to me. You are. You're talking to me. Stop watching television, Emily and Cooper. You have to get outside and do that. That's me you're talking to. I know. One of the reasons that they say diabetes is a silent killer is because if it's not the quick onset, some of these symptoms are silent. You don't have any idea that you have them. And it's not until, the frequent thirst, the frequent urination, fatigue, things you could explain away for other things.
Right.
I'm getting old.
That's the biggest one we hear.
I'm getting old. I'm supposed to be tired. My vision's blurry because I'm getting older.
Right.
And so,
so people, they avoid getting diagnosed, getting checked out, and sometimes they've had diabetes for a long period of time, and when they finally get diagnosed, they're already having complications because it's already been happening for so long before they, got attention for it.
And what are some of these complications? They're going to the doctor for another thing, and they find out that they've had diabetes.
Sure.
It's probably, or not probably, but could have been what led to this other condition, being damage to your heart and your kidneys, your skin and your feet, your teeth and your gums. Your teeth and your gums. What happens to your teeth and your gums when you have diabetes?
It's more like frequent bleeding, frequent infections. You've heard of gingivitis.
Right.
I'm not a dentist, so I can't go into much detail with that, but those are more common ones that you would see for if their blood sugar's running above what it should run.
See, I would never have thought that bleeding. I would just thought, I flossed too hard, or But if you have it more often, then that might be a sign. Damage to your feet. How important is good foot care, particularly once you've been diagnosed with diabetes? How important is that?
People with diabetes need to look at their feet every day because nerve damage can develop in the feet called neuropathy. And when you don't have a good sense of feeling in your foot, that puts you more likely to injure it. Stub your foot, step on something, and because you don't feel things so well, you might not even realize you've hurt your foot.
Okay,
so then infection sets in, and that's what leads to.
So I've heard that if the infection, because people don't look at their feet, and they don't look in between their toes. I don't do that.
Right.
Feet are not the prettiest things.
Right.
But if you have diabetes, it's very important to even check between your toes, because if you have an injury to your foot, the neuropathy,
get early help for
it's
it.
the you don't feel it. So, for instance, the complication, if you have numbness in your feet and in your hands and things, that you may be going because I can't feel it, and find out that you have diabetes.
Right.
And you said that there's a test, particularly every once a year, to feel for your feet.
Right. Your doctor or diabetes educator can do a little exam on you with something called a monofilament, where you actually touch the bottom of the foot to test the sensation to see how well a person can feel with diabetes. And if they don't feel those touches, they may have neuropathy, which puts them at risk for amputation down the road. So once a year they need to have a monofilament test done to test their feet. And visually themselves, they need to look at their feet every day.
And to make sure they're dry, is that true? To make sure that they're good and dry and clean and good socks and shoes. Because if sometimes I've done a diabetes show before and their feet change shape. And with the changing of the feet, if their shoes don't fit just right, they rub. And what happens if your feet rub in your shoes?
Develop blisters and sores, and
calluses.
You may not heal, and if you don't heal, infection sets in. That's what leads to that risk of amputation.
So it's very important that they check their feet and look at their feet, something that we don't do every day and take that for granted. One of the things that we only have a couple more minutes in this segment, are you more susceptible to heart disease and stroke if you have diabetes?
2 to 3 times more likely.
How many?
2 to 3 times more likely versus someone that doesn't have diabetes.
And on the statistics I saw, more than almost 225,000 people had some contributing factor in their death certificate to diabetes. 225,000 people in 2002, so it's more now. And probably more than that, because if they had chronic disease, then they may not even attribute it to diabetes. So I just really have become a firm believer after losing weight and dropping my blood sugar that sugar is not a bad thing, but if you don't control it, it can lead to all kinds of trouble that you haven't even thought about.
Right.
And once you're there, Debbie, you're there, and you're always a diabetic.
That's right.
And you have to think about that. Let's go ahead. We're going to test my blood sugar. Have you know I'm very afraid of needles or pricking my finger, the whole 9 yards, but we're going to do that. We're going to do it in the break, and we're going to come back, and Debbie has to go, and she's going to actually do the test, though. And you have to go, but I appreciate you joining us, and we'll be back with you, Tish, to talk more about what happens after you're diagnosed and get my results. Stay with us. We'll be right back.
The storm.
I am the line in the sand.
Roger that, everything looks good. I am the rescuer in the dark. It's okay, I got you. I am the enforcer of the seas.
We are the defenders of the homeland. We are the shield of freedom. We are the United States Coast Guard.
Heed your country's call. Join the Coast Guard or Coast Guard Reserve, the shield of freedom.
Welcome back. I've just gotten my diabetes test. Tish, tell us a little bit about, this was a fasting glucose test. Tell me what my results were before we go in and see how well I did.
Well, so they don't think that I'm telling a story, what I'm going to do is call it up on the monitor on here.
Okay.
But her blood sugar was 80. So that's considered to be norm. We typically say less than 100.
Okay, so that was good.
70 to 99 is considered to be normal. So,
Okay, so
you're normal.
That's to be debated, I'm sure. But my blood sugar is normal.
Yes.
And I was fasting. I haven't eaten since probably 8 o'clock last night, and this is the afternoon of the next day. So that was a good level. If I had eaten, how would you regulate?
There
to
is a
tell?
range on that. They typically say if, again, someone that does not have diabetes, the blood sugar shouldn't be any higher than 140.
Okay.
So it can go up to 140. someone that has diabetes, because I get asked that question a lot, well, what should my blood sugar be if I'm diabetic
Right.
and I eat something? We typically tell people at least 2 hours after a meal, 2 hours after a meal, it should be 180 or less. Now, let me also throw in another recommendation. That's what American Diabetes Association, that's their criteria. Now, there is another criteria by the American College of Endocrinology. Endocrinologists, they specialize in that disease state. Their criteria is 140 or less.
Okay.
So, just telling the individuals out that are watching today that if your doctor says it should be less than 140 after you eat, or if they say it should be less than 180 after you eat, either one is fine to go with. We use less than 180 where we work, because that's who we're certified through, is American Diabetes Association.
Okay. And you said 2 hours after.
2 hours.
For instance, you can go to your doctor and you can have the test that I just had, or you can use something that you buy over the counter, and they have them just like that. You prick your finger and you can test your blood sugar fasting or after 2 hours and know if it's 180 or under or 140 and under.
Right.
The other test is more of a diagnosis kind of test, an OGTT. What is that?
That's an oral glucose tolerance test. We more commonly see that, I guess more commonly used for gestational diabetes. That's what we more commonly see. But to actually be diagnosed, this is just a screening tool, this device here. And this is, you probably see the area hospitals and health departments do blood sugar screenings. That's all it is, it's just a screen. If there's a little elevation, you need to go get examined by your doctor. And typically, whenever I say get examined by your doctor, they're going to draw it from your arm.
Okay.
That's the most accurate. There's about a 10% difference between the number on here versus the number that they draw from your arm. This is a serum blood sugar level, whereas this is a capillary. So there's going to be, it's not exact. I've had people tell me, well, I checked my blood sugar before I had it drawn at the doctor's office, and there was like a 10, 15 point difference, and that's true.
I mean, and it could have been when they tested, when they had they eaten, what they had eaten. It's a big deal about when you eat and what you eat. Now, you brought some examples with you that I thought were very interesting.
Yeah.
To show my blood sugar is 80, but if it were elevated to say to be diabetic, which is over 126, the difference in what it looks like.
Well, what I have here is, you all didn't see this during the break, that we actually pulled a lot of blood from Tammy. Just kidding. This is actually kind of like what the viscosity of your blood looks like at normal level. This is running at like 100. And no, this is not blood. This is a model that we use in the classes that we do. But you can kind of see how it runs fairly smoothly. It's not real thick. And what they have found in people with diabetes is that the higher your blood sugar is, the thicker or the stickier that the blood gets. And of course, this is a more extreme level of blood sugar at 400.
Okay.
And it's kind of like Heinz ketchup. It's not going to run as smoothly.
And that runs through your veins like that.
And you know, the other point that I make too in class is I tell people, you can see if you're contemplating with yourself or telling yourself, it's okay, it's running 300, and trying to tell yourself you're not going to have problems with that, you feel fine, you think how that thick blood is going to get all the way down to the end of your toes, get in those small veins in your kidney, get in those small veins in your eyes. It's not going to get there. So again,
It's going to go to the most important places. It's to the important organs. So
when
the
I say it's not
neuropathy-
going to get there, it's just the thickness of it, the
okay.
stickiness of it. I'm sorry. It's just so thick. The circulation's not going to get there.
Is that where
with
the
blood.
numbness and the neuropathy can come from? It just doesn't make it to those extremities.
Right. It's just not getting all the way down
It's just
there.
not getting there. And that is that a not a normal, but 400? Do you see people coming in with blood sugars at 400? Is that common?
Yes, it is. And I work also in the hospital, along with working in the center that we have as well too there at the hospital. But in the hospital, and I'm sure doctors have better stories than what I have, but I have seen patients with theirs in the thousands.
Wow.
So it can run extremely, extremely elevated.
Wow. And they
that's
have
what-
no symptoms. They come in.
Well, they come in and they're not thinking they have diabetes, but they're coming in for something else.
Right.
They can't breathe because your body, and it's running that elevated, it can shut down.
Really? So again, the symptoms are things that you don't, the blurred vision, the numbness, all of the things that we talked about in the segment before. Could you talk about those just one more time, some more of the symptoms of diabetes? Right.
More the symptoms of diabetes is dry mouth, frequent thirst. When I say thirst, I'm saying you have to have something just like every 5 minutes. When I was going through that stage when I didn't know I was diabetic, I was drinking water nonstop. I was also drinking Coke and juice. And we'll get into talking about foods that have sugar in them or carbohydrate. I was drinking that. Well, what do you think that's doing to my blood sugar? It's making it go even higher. Frequent urination, I already mentioned. Tired, fatigued, vision can be blurred, headaches.
These things again can be attributed to other problems. But when you have these and you're going in for these conditions and you find out that you have diabetes, that may have been where it started to begin with.
Exactly.
And these other complications came about because of your elevated blood sugar.
Right.
So again, I say how important it is to keep that regulated, to fend off some of these other diseases and problems that you may have predisposition to as well. Heart disease if it's in your family, high cholesterol if it's in your family. But if you can keep your blood sugar, it at least fends it off a little bit more and under control. Once you've been diagnosed, again, diet and exercise. I mean, that's the next step, isn't it?
That's for type 2s. And again, to distinguish between type 1 and type 2s, there's majority of your people's diabetes, I mean, I guess whenever I first started working as a dietitian, about 90 to 95% of the diabetic population had type 2. That's grown. It's more so in the 94, 95% population have type 2.
Okay.
But with the type 1s, there's very few of us, about 5, maybe 8% of us. I lost my line of thought. What was your question again?
I'm the diet and exercise.
Diet and exercise, sorry about that.
That's okay.
With type 2, that is the definite way to go as far as treatment. It is with type 1, but going back to with type 1, they have no insulin. So they have to have insulin on board
So
as far as treatment.
you are insulin dependent then?
Yes.
And so you have to take insulin every day?
Shots, correct.
Shots every day. Now the question that I have with that, diet and exercise, okay, they correlate together, all right? Depending on what you eat, depends on how much sugar you have. Then you have to exercise too, and then that depends on how much sugar you burn. And so how do you, and then that depends on how much insulin you need to inject. So how do you regulate that? How do you come up with a lifestyle that, particularly if you're type 1, okay, I need this much insulin, but depending on what you eat, that changes, and depending on how much you exercise. How do you deal with that?
Well, when I was first diagnosed, again, I was 11. It's been over 20 years ago, probably about 23 years ago. I won't tell y'all how old I am, but anyway.
You just did,
I
Tish, you
know.
just did.
But back then, I really didn't go out and get education like I should have. We did initially, but we didn't have what we have now. Thank the Lord, there are diabetes centers and places you can get education on. But my point is, learning that, I was only taking 2 shots a day. The types of insulin that were out at that point, what they have now is so much better. To give you an example, I would have to take my insulin injection and wait a half an hour before I ate. Well, if my blood sugar is running 300 before I eat, I might have to wait 45 minutes before I have to eat. And the reasoning for that is so that insulin can help lower that blood sugar level before you throw down a meal, before you get ready to eat a meal. So the timing was crucial, very crucial with that. Now they have insulins out there that can work within about 10 minutes.
Wow.
Whereas the insulins, whenever I was diagnosed, they took at least a half an hour before they took place. So I guess as far as answering your question, I guess personally, I have progressed. I guess more so as researchers have found out so much more about the disease, and knowing, hey, we're looking at being consistent on our carbohydrate intake. Let's start using this new type of insulin that can work within 10 minutes. So there has been so much more that has been advanced in the treatment of diabetes. Now, I guess I'm getting back to answering your question on how do you balance it all. It's a have to. And maybe to my benefit, I was diagnosed at a young age versus someone who's 50,
Right.
60, 40
and
years
set in
old.
their ways.
And set in their ways. But I also have to look at it too. It's not a full benefit either because I'm more at risk of having problems later on.
Right.
But I tell people that I work with, you're going to have to look at it as making a change. And if you can't make a change, it's not going to work. So that it really has to come from within themselves if they're serious about it. Something happens in some people that makes them change. And whenever I say makes them change, makes them start eating 3 meals a day. I set very simple goals with the people that come in my office. For example, I may have someone that gets up every day at 11 or 12 o'clock. They eat 1 meal a day. And again, going back to what we talked about earlier, your pancreas just can't handle that amount of food on one meal a day. I'll set them a goal, let's do 2 meals a day. And what we do is we follow up with them to see how they're doing as far as making changes in their lifestyle. And it is difficult because if you come in and you tell me, you're going to have to start doing this, I'd be like, okay.
You know,
But
at
if
age
you
11, your parents still had some control
Right.
over what you ate and
Yes.
how much you ate. But at 37, you tell me I'm diabetic and I have to start making all these changes in my life. That's a hard way to go.
It sure is.
And learning to regulate how much I eat with how much I exercise, with when I can eat. It's a hard balance.
It is.
And we'll move into, you have some foods here because it's not just what you eat. It's critical how much.
Exactly.
And it's portion size. And I think not only with diabetes, Tish, but with losing weight, portion and moderation is where people just lose it. Because when I tried to lose weight, it's a very hard thing to train yourself to learn when you're full. When you've been eating and you can eat and your stomach stretches and you do all those things like my cells stretch like you told me, and my insulin had a harder time getting into those, the key fitting in the lock. So to speak, I could eat more. And then so trying to cut back and learning, okay, I'm full, and giving myself time to be full. It's retraining your brain. It really is. And so it's bound to be retraining your life as well on portion size. So talk a little bit about portion size and what that means.
Portion size is, and again, you may think, I can't believe she says this to people, but going back to setting simple goals with people, that's what you have to do. At least I've learned that in my profession, is setting simple goals with people. And it might be, if your plate is this big, I want you to cut it back to this size. We'll get into detail with it weeks later.
Okay.
But if that's all you can do, that's great, because the only thing it's going to do is help with your blood sugar level. And you may think, well, that sounds pretty small and pretty minute. Well, yes, I could go with all of these guidelines, and they're going to be like, that's not going to happen.
Yeah, that's
so
over
when
the
we
top.
talk
Why
about,
even try?
Yes, so we try to set simple goals. I mean, one change is better than no change at all. But what ADA is actually recommending for us to start teaching people is what's called being consistent with your carbohydrate. And the question that I ask people is, what have you heard about carbohydrate? Well, everything's bad. People tend to hear about carbohydrate. And of course, what I try to do is retrain them and say, it's not bad. It can be bad. It can be harmful if you eat more than what you should, just like fat. Fat can be bad if you eat more than what you should. So we need a balance of fat, protein, and carbohydrate. You need all three of those. When you let go of one, something's going to give, something's going to happen. So as far as carbohydrate consistency, they typically tell, and this is more so geared towards type 2s, it can be with type 1s as well to an extent, depending on what age that they're at. But type 2s, for females, they tell them that they could keep their carbs about 45 to 60 grams of carbohydrate at each meal.
Okay, I was hoping you were going to say each meal and not a day. Oh my goodness. Okay.
At each meal.
40 to 45.
45 to 60 grams of carbohydrate at each meal.
Okay.
For females.
Okay.
ADA also gives a recommendation for men. Men always get a little bit more than females.
They do.
but that's okay. Men can have anywhere from 60 to 75 grams of carbohydrate per meal. Now, one of the key things that I do in the center is I tell the individuals, okay, I've set these goals with you. How do we know that your body can handle that amount?
Right.
Because many times they might give me a look like, that's going to be way too much. This is probably one of the things that I really tell people to do. Why don't you test your blood sugar a couple hours after you eat the amount that I'm telling you to eat, see how it's running.
Okay.
And you can kind of get a pattern after about 3 or 4 days to see how it's running.
So buy one at Walmart.
You can get them anywhere. You can get them
Anywhere,
at
in
Kroger pharmacy. Yeah,
anywhere.
any pharmacy.
And just test it after every meal and kind of see what's happening.
That's a good question. We typically like to suggest for people, and this is ADA's guidelines, check in when you get up in the morning.
Okay.
That's usually a fasting, because you don't want it running elevated, if you're sleeping 7 or more hours. But check in the morning. But don't go with that one blood sugar for the rest of the 24 hours, because you're going to eat, right? Hopefully.
Right.
I tell people, check it 2 hours after any meal and see how it runs. Yes, if insurance-wise, because these test strips are not cheap, and those of you out there that have diabetes, you do know that. But financially-wise, if you can check it, get by with checking it twice a day, check it in the morning, and then check it 2 hours after a meal, and vary the meal that you test. Like Monday, you'll check it 2 hours after breakfast. Tuesday, check it 2 hours after lunch. Wednesday, check it 2 hours after supper. Then go back and repeat. Check it 2 hours after breakfast, and so on and so forth.
And this is with things that once they've come to a dietitian, because that's one of the questions. Why do I need to go to a dietitian?
Because we know everything.
That's right. That's exactly right.
No,
but you can help
no.
you can help set these guidelines and these meals for them so that they're not struggling with all the information that's out there. I mean, because you had talked about that, to know what to eat, to have any concept, and you will tell them portion
What types
sizes,
of
like
foods
for
have-
instance, a piece of chicken, and just kind of show. Is that what?
Yes, this is considered to be like 1 serving of a meat. When I say 1 serving of a meat, 1 serving would be equivalent to about 3 ounces. And the other thing that I like to tell people too, again, we do this in the class, is that 3 ounces pretty much looks like the size of a deck of cards, or if you don't care if I pick on you, it fits in the palm of a lady's hand. So that's about a 3 ounce portion of meat.
That's not very much.
About
is
that
it?
wide, about that thick, exactly. We all tend to eat more than that, including myself, and I try not to. But
Well, and that's a question. Is someone having type 1 diabetes? I mean, even though you are a registered dietitian, you're an educator in this field, is it still hard for you?
oh yeah, it's still hard not to want to overdo it. But I do have to set limits. Anybody has to do that. Be wise in that. And kind of, we were joking earlier, and I actually say this in my class as well, you're going to have days where you're going to fall off.
Fall
You're
off
going
the
to mess up.
wagon.
Get back with it. It doesn't mean you're a failure. I think some people feel that way, that, I messed up.
Well, I
and
messed up,
don't.
so quit trying.
Yeah, exactly.
Right.
And I tell them, don't do that. You're not
Well,
going to be perfect 7 days
Well,
a
it's
week.
the same thing with losing weight. It's the same exact thing. I have
That's right.
days when I eat everything in sight. I mean, everything in sight. And I have to say, okay, tomorrow's another day. We're going to do something a little bit different. So portion size is very important. We only have just a few minutes left. So here's a portion of green beans and juice, because it has natural sugars in it. This is
That too is that's considered to be, again, when we do teaching, that's a half a cup, to answer your question.
so you can have this in the morning for breakfast.
That's considered to be 1 carbohydrate choice. That's about 15 grams of carbohydrate right there.
Now, when they come and see you, Tish, and they do that, you will give them the guidelines that they need. You will tell them what the portion sizes are. You will tell them, okay, this is how much you can eat. This is what you can eat. So give us some phone numbers. You have some contact numbers to make an appointment with you to, if they have diabetes, to get this information that they need.
The phone number, it's area code 270-415-2121.
Okay.
That's where you can make an appointment.
Okay.
You know what? I just messed that up. It's not 415. I take that back. It's area code 270-444-2121.
Okay. That's to make an appointment.
That's to make an appointment. Now, our office has a different number, so I apologize. To talk with Debbie or myself in the Diabetes Center, it's area code 270-415-4052, or they can call 270-415-4056. And that's if they have questions, just maybe like
From
yourself
seeing the
calling and
show
saying,
and-
what food's got carb in it? If they have a question,
Right.
want to know more about our diabetes program there at Lourdes. But again, to make an appointment, it's 270-444-2121.
And that's very important. And then again, you will also, because reading labels is becoming harder and harder, we only have a couple of minutes left, and we're going to actually leave you with a couple of recipes that I got offline, just a couple of things that looked really tasty, and seems to be, even if I'm not diabetic, a good rule of thumb to follow. Some of these things, I don't know anything about exchanges or, you know, trading out the carb for the protein or anything like that, but it just seems like a good way to go to cut the fats and to cut the carbohydrates and to read the labels, you know, that 23 grams of carbohydrates in this can versus 6 grams of fiber and 7 grams of sugar. The sugar is part of the carbohydrate family.
Exactly.
So that's, what is that? 30. And so that's 30 grams that you have to count in that.
What we
Is that-
actually, it's not looked at that way. We actually teach people to look at total carbs.
Okay.
And like you were saying, sugar's a component of that, so is dietary fiber.
Okay.
They're components. So when you're looking at labels, you just look at total carb.
Great.
Because just like that goal I was telling you, you want to try to keep your goal about 45, 60 grams of carb
And
at
you
each
have-
meal.
You really have to pay attention to the serving size, because you
Oh,
think, oh,
yes.
23 grams, that's not bad, but this has 3.5 servings
in the
in
whole
it,
can,
in
yeah.
the whole can. So you have to be really portion size and serving size and portion size, and what you eat is very, very important. Tish, I really appreciate you joining us and also sharing your story about, you know, how it's a struggle, even for you. Who preaches it every day. You have to walk the walk, not just talk the talk.
Thank you.
And I appreciate you coming and doing that with us.
Thank you for having
We're going to
us.
leave you with a couple of recipes. I do believe, let me get here, oven fried onion rings, which you know, fried you can't have, but I found it on the website, the diabetes website, and banana shakes. So I hope you enjoy these recipes, and I hope they're really tasty. Join us next time on Healthy Living. We'll see you next time.